Hi. So, it's ready here? Joseph, it's ready. Hi, can we start? Good morning. I'm going to show you a new treatment, a new concept in dermatology treatment, which is called iTED. So it's about transepidermal drug delivery, and this is the first device in its category to introduce this concept in the market, because we are going to show not only the skin fractional ablative resurfacing, but also we are going to use an impact ultrasound after applying the drug. So let's start showing the device. There are 3 steps. I'm going to start using pixel RF to do an ablation, fractional ablation in the skin. And I have 2 options, stationary tip and in-motion tip. I'm going to use the in-motion tip with this power. And we are going to treat stretch marks, but we have many other indications like photodamaged skin, hypertrophic scars, areata alopecia, used together with photodynamic therapy. I hope we have time to show some results. And after this first step, I'm going to apply a cosmeceutical just after the procedure. And after the 3rd step, I'm going to apply an impact ultrasound. Let me show. This 3rd step, I'm going to use this impact ultrasound to push the drug into the epidermis through the microchannels preformed by the RF tip. Okay, so let's start. And let's show the patient. Can you give me something to clean here? It's not open yet? It should be. It should be. So we can use many different cosmeceuticals or drugs to treat. Today we are going to use this profound, which presents a pre-treatment, a treatment, and post-treatment all together. Someone to clean. I need the first one to clean the skin. Where is the cotton or gauze to clean? It should be here. It should be here. So at first we're going to clean the skin, and then I'm going to apply the radio frequency, then the cream to treat, and after that post-treatment. She is a very good indication because she has not only the stretch marks but also laxity. So she don't have gloves for me. So,
dear doctor, should you precise us what sort of device is pixel RF, please?
Yes, okay. Pixel RF is a fractional radio frequency, ablative radio frequency. I can show you. So this tip is a roller tip, and with this tip, we are going to, it's an electromagnetic energy, and applying very superficial on the skin, we are going to promote sparks, microplasma, like microplasma, and we are going to ablate the skin fractional.
And what about the length? And
it's an electromagnetic energy. It's not a laser. It's a radio frequency. It's not laser.
Yes, but the depth of your
40 hertz. What?
Of the penetration?
The penetration depends on the energy we are going to use and the number of the passes we do on the skin, but mainly 80 to 100 microns on diameter and 100 to 150 in depth.
Thank you.
So let's start. Yes, let me do first the, it's clean, isn't it? So we can divide the skin into grids 10 by 10. I'm going to start here. And we do crosses. Me? I'm in front of the camera.
No, not you, sorry.
One pass, two crosses again. I'm going to do again. To promote microchannels again. We can see the evolution. Again, another cross. The picture is a little bit burnished. Okay. The third. Okay. Now we finish the first step.
Do you have to do?
What?
How many passes do you have to do?
Around, at least 2-3 passes. Two
pass?
crosses, one pass. So
Okay.
6 times. Yeah, 6 times. So we can see that the skin is red and we can see some furrows. And now I'm going to apply the cosmeceutical. Here I'm going to use this profound, but usually I do tretinoin, retinoic acid, 0.05 in cream. So let's do this one. Or here. Okay. We're going to apply the cosmeceutical. The cosmeceutical, the drug, are chosen according to the disease to be treated. Okay? Now let me show here in the device. I'm going to change, come back, and I'm going to use now the impact ultrasound. It's a different ultrasound which push the drug into the skin through the microchannels preformed by the ablative method. So we are going to use 50 hertz with 50% of impact. And I'm going to apply the ultrasound. Yes, but it's not ready. Now it's ready. I'm going to apply the ultrasound, and you can see that the drug will be pushed into the microchannels, and you feel the noise that, and the substance will be absorbed. I have to do this movement until the drug can be completely absorbed. Is it okay for you? Now the noise is changing because of the product is being absorbed. It's important to say that both tips, radio frequency tip and this ultrasound, are disposable. Yeah. We have to do at least 4 to 5 treatments with 2 to 4 weeks interval. Any question?
You have question in the audience? No, please go to the microphone and take it. Oui, 00. Repeat the question.
Hello? Can you hear me?
Yes.
How much reduction is seen after 4 to 6 sessions in stretch marks? How much percentage reduction?
I didn't understand how much.
How much reduction is seen after 4 to 6 sessions in stretch marks?
The improvement.
Improvement, yes.
We did a study in Brazil with 33 patients. I'm going to publish this. We used tretinoin with 0.05, and according to the doctor evaluation, we had around 70%, between 50 to 75% of improvement, moderate to intense improvement. I have some results to show if you have time. I have some before and after to show. Now we can see that the medicament had been completely introduced into the skin and it's dry. Okay, so it's time to finish. Okay, and we are going to do the post-treatment. This cream is to relieve the skin. We can see let me show first. We can see the erythema and the edema, and the stretch mark comes like this, like.
Hello?
Hello?
What about erythema and redness we see? It is normal or not? What is the cause of erythema?
I didn't understand. Can you repeat, please? What kind?
What is
No,
we
it's
see
cleanser.
erythema and redness? What is the cause of erythema and redness?
The amount of
is it normal or not?
the redness we are seeing now?
Erythema and redness.
Yes, the erythema depends on how many passes I do, but usually it's just like this, mild to moderate, and it still maintains like this for some hours and become better in 2 days, and completely recover in 1 week. In the body maybe 2 weeks, but on the face 1 week. So we finish here. Can we show the results? Any more questions? I'd like to show some before and after clinical results, and if you have, we can discuss these cases, or if you have any question to do, can we show? Clinical
You
evidence.
have the cases on the computer?
Yeah.
In the operating room?
Yeah.
Yes? Okay.
Yes. Tem que pegar meu computador. Então, pega meu computador ali.
Hello.
Hello.
For dark patients, is
Meu
there
computador.
hyperpigmentation?
Meu computador ali naquela. My computer. Sorry?
For dark patients, is there a problem with hyperpigmentation? As
I had, in 71 patients, I had only 1 case of hyperpigmentation. I didn't have problem with hyperpigmentation. That's why I think this is a good technology to darker skin. It's better than using lasers, as it's better than erbium and CO2, comparing this kind of side effects. Yes, now the results are on the... of course, if we have darker skin, it's better to do less passes. In the same way, when we are treating melasma, that I'm afraid to treat melasma, but it's possible, we have to do 1 pass or 2 passes with low energy, and then apply hydroquinone or other depigmentant. Let me show the results. Is it possible to show here? Mas eles vão ter que focar aqui, né? No, it's okay. So, okay. So, this an example: a patient after 2 sessions with stretch marks, white stretch marks. Can you the other one, please? Another case, the breast area. I think is one of the best area to be treated, with good result after 3 sessions using tretinoin, 0.05% in cream. Next, please. This is a case treated to hypertrophic scar, I used radiofrequency, steroids, triamcinolone, just 1 drop of steroids, and this is the result after 1 session, 1 week after 1 session. It's a little bit noisy. This case, treating acne scars, I used ethanoic acid, hyaluronic acid, and vitamin C after 3 sessions. Can the next one, please? And treating areata alopecia, I did the radiofrequency and I used steroids, triamcinolone, and then applied the ultrasound after 3 sessions with 2 weeks of interval. And the next case, areata alopecia again, and I need 6 sessions in this patient. And the last one, can you, next one, please? Yeah, I used this machine, Legato, before PDT. I did the radiofrequency, methylaminolevulinate, and then the impact ultrasound, and the result was much better comparing to the other arm. I did the standard protocol of PDT. I had not only the improvement of the actinic keratosis, but also the photodamage skin. The skin was much better. So we can use Legato with this concept of transepidermal drug delivery, many different dermatoses, and choose the drug according to the disease to be treated. More questions?
Yes, just one question concerning the PDT. You have data showing that you improve penetration of ELA or conversion of ELA in PP9, or it's only clinical observation?
It was only clinical observation. I did different protocol in both sides in more than 1 patient, and I did the side I used the radiofrequency to improve the penetration of the methylaminolevulinate. I reduced the incubation time for 1 hour.
Okay.
And the standard protocol with 3 hours I did the same, but it was only clinical response.
But you use Medvix or
Metivix,
ELA?
Metivix and Actylite, LED.
Okay, and the sites that you have treated with Legato, the PDT is more painful than the other sites or not?
A little bit, because PDT is painful, and the patient reported the burning sensation during the RF, but during the illumination, yeah, I think it was almost the same, but the post-treatment was a little bit more difficult in the side treated with the Legato, but nothing, it was bearable, completely bearable.
Thank you.
Okay? Thank you.
Excuse me.
Another question.
Não tava nada pronto, né?
Ah, je crois qu'elle a...
Vocês me matam do coração, né? Não tava nada aí. Não tinha uma gase.
You have another question.
Okay?
Can you tell me what sensitizer are you using in the PDT? Are you using Medvix or